Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Good evening, everyone. I'm Ed Ellinger. I'm the Commissioner of Health for Minnesota. I'm also a pediatrician, and it didn't take me very long before being a pediatrician and seeing the kinds of kids that we saw on this film to realize that we couldn't treat our way into health, that we really had to move upstream and change the conditions in which people were living.
We all like to think of childhood as this time of joy and innocence. But, for many of us, it's just not true.
When you grow up in these type of situations, it's not something you talk about. I know I didn't.
The first thing that we found is that adverse childhood experiences are common.
Kids are young, they don't know what's going on, they won't remember anyway. Well, the child may not remember, but the body remembers.
There was this incredible gee whiz effect. You mean adverse childhood experiences cause heart disease and lung disease and liver and cancer?
Exposure to trauma affects children's developing brains. The impact is on your behavior, it's on your heart, it's on your DNA. Like, how do you deal with all that?
I don't reach out because I'm not used to that.
We have a whole new body of knowledge now that could open up what we have up till now been seen as intractable, unsolvable problems.
No child should be punched or kicked. No child should be punched or kicked.
If you can get the science into the hands of the general population, they will invent very wise actions.
Do you feel like any of the interventions have been making a difference?
They made all the difference in the world.
It's there, it's possible, and a defeatist attitude is completely disconnected from what 21st century science is telling us. And we should be going after that like a bear.
So I got into public health, and now as state health commissioner, my job is actually to help people figure out ways that we can create health. Yes, create health, because it is something that we all have some role in doing. Health doesn't happen by accident. It is because of the systems that we set in place and the conditions in which people live. And so that's why I started the TV show, A Public Health Journal, which was really to talk to folks about what creates health and start to develop a different narrative, that it's not just about medical care, but it's also about the conditions in which we live. And so tonight, we're taping this to be putting on as part of A Public Health Journal, so thank you for being part of that. And so it was really important to focus on narrative, and that's why it was really nice to see this film. Jamie, thank you for a wonderful piece of work. It is incredible, so thank you very much. And also invited Syl Jones to be part of this conversation because Syl is a playwright and has done some work related to infant mortality and gun violence and mental health, and is now working at Hennepin County Medical Center on narrative medicine, how to get the story out and listen to stories and tell the story. So Syl, thank you for being part of this.
It's terrific, thank you.
Jamie, with this powerful piece, you, I'm sure, can do a whole lot of things in a whole lot of areas with all sorts of issues. How did you come to choose ACEs as a way to put this kind of work together?
I didn't choose it. I have a partner, Karen Pritzker. We have a film company together. We did a film about dyslexia about 4 years ago, and we were looking at what was going to be our next push. And she had an early look at the ACEs study. She attended a conference, and Dr. Vincent Felitti gave a presentation. And it just knocked her out. So she got a copy of the original ACEs study that was done and called me and said, "I'm sending you something. This just can't be true." And so she sent me the study. So the very first thing I encountered was just the hard numbers. And of course, the numbers are staggering. I mean, once you realize the frequency with which these things are happening and the multitude of them and what the biological effect is, that just was completely new to me. I had no idea. And then quickly I realized, well, this is, it's clear, so the ACEs study says if this is going on, then this is what happens. And in other words, this is bad news. But how do you make a movie about bad news? I mean, that's a drag. I just spent a couple of years making a film about bad news. But I had to earnestly ask myself, are there any best practices out there? What are the solutions? What are the hopes? And spent some time investigating. And that's why we ended up with 2 movies. Paper Tigers followed a high school in Walla Walla, Washington, and dealt with the question of what about these kids that have already been impacted, who haven't had the benefits of early intervention, of sort of systemic care that can prevent some of this toxicity from having a biological effect. What about them? And it turns out there are things you can do. And so Paper Tigers follows a year in the school in Washington in which the entire staff from the principal on down were trauma-informed. And you can judge for yourself if you see the movie, but it's really interesting. You realize it's just institutionalized compassion. And if I was on the West Coast, I'd throw in the word love, but I don't know, man. I mean, this is
love
Minnesota. I don't really know.
Yeah.
I've never been here before. So, actually, I was here a couple of years ago in Rochester. So,
Well, how did this film, making the film, impact you and your crew? I know that when we talk about ACEs and we do ACE scores, people have emotional responses, and sometimes we need to have therapists in the room to be able to deal with all the stress. How did it affect you and your crew in putting this together?
Well, a lot of conversations, because it's in all of our natures to personalize, and there's nothing wrong with that. I think we found ourselves, and I think for the average person, it's why this is. Just in a broad sense, why this should be such a broad cultural part of our narrative of understanding our health and our own story is that, we can look back over our lives and look at our experiences, and very often, if it's not the biological effects, you can see why you have certain triggers. Why do I have this? Why do I consistently step in this hole? Why do I trip on? It's helpful in terms of self-discovery. It's changed the way I look at a number of things, and it seems like everybody I worked with went through the same experience.
Now, Syl, I know you came to our community health conference and shared your personal story about adverse childhood experiences.
Yeah.
And as a playwright, I'm curious on your take on this movie, on some of the conversations that occurred there, and how and the work that you're doing in narrative medicine.
It's brilliant. First of all, thank you so much for doing it. I will say the thing you mentioned about love is interesting because I do teach interns and residents, and I had a session where I was trying to talk to them about love. And of course, immediately they said, well, we're not supposed to talk about love. We're not supposed to love our patients. We can't say that word because there's a lot of legal, ramifications. But, I'm a child of the 60s, and I still believe that love is the answer. And so that's part of what I actually teach, and I can guarantee you that by hook or crook, some way, this film is going to be part of what we do with our interns and residents who are seeing a lot of the things that we see in the movie, but they don't know where it comes from, and they're not trained in medical school and how to deal with it. And whoever came up with Miss Kendra's story, that's an amazing piece. It doesn't say in the film where that comes from exactly, but I love it, and I hope to be able to use it myself. Because one of the things we talk about in narrative medicine is that patients have stories, right? We all have stories, most of us have some ACEs. But doctors have them too. And the intersection of their story with our story as patients really is important. And many of the physicians that I talk to are not necessarily into self-examination. They're not looking at what, where they came from.
Let's say surgeons.
Oh, surgeons. Okay. All right, surgeons, radiologists, whatever. But the point is that
God, actually.
they have to know about their own history. So we spend a lot of time having people actually look at what their own history is. I'm talking about doctors now, or people who will be doctors. And it's astonishing the number of them who say, gosh, maybe that has an impact on how I look at that little kid that comes through the door and is always late, because I had a similar problem, or I had something like that, but I'm trying to repress it, and I haven't really acknowledged it. So when I first read the ACEs study, I did the same thing the guy did in the movie. I wept, and I could not stop weeping, because it actually explained to me that I wasn't crazy. And that's why I think the power of this movie will come from, ultimately, is many people will see this and go, oh my God, this is why I feel the way that I do.
Mm-hmm. Jamie, who's the target for this movie?
Oh, man. Well, in the scheme of things, Paper Tigers was meant for a general audience, because it had the more traditional aspects of a journeying narrative, beginning of the school year, end of the school year, the transition that happens with the kids during that time.
It's a documentary.
Yeah, I'm sorry.
Okay.
Paper Tigers is available right now. Through tug.com, you can have educational versions of the film. You order it online, tugg.com. And it airs on Pivot Television in August. We've had about 500 plus screenings of the film in the last 8 months. It's really struck a chord. And the nice thing is that Resilience will follow up and go right in behind it, having established roots in the community. So Paper Tigers is that documentary, and it's sort of an hour and a half. And this was really supposed to just say once and for all, what the hell is going on? That's just basically, what is this thing and what do we do about it? And just, it was more issue focused, structured as a more issue educational film. And you try to do it in a way that, you disguise that, because, most people think educational films are really boring, and sometimes they are. And so you just try to do it in a way that, important things that have to be known, you try to do it in a way that people can actually make it through it. Partly why it's an hour.
Yeah.
Because, 90 minutes of this would be pretty rough.
Yeah, but it's great. An hour is perfect.
Yeah. Well, I like the fact that we're trying to change the conversation about what creates health. There's the common narrative is that if you just have good medical care, and if people just pull themselves up by the bootstraps and make good choices, we'd be healthy. And we need to change the narrative that it's actually the conditions in which people live, the social circumstances, the economic circumstances, the cultural circumstances. Do you see this documentary helping to change that narrative? That's why I asked, who are you targeted at? Because this is going to be...
I dodged that one.
Because I want to use this to actually help change that narrative.
In my mind, really, if I could wave a wand, this movie would be seen by every single person working in the public sector that is working, in all facets of our society, serving our society. Because if you're a police officer and you understand this and you really get it, then you're going to behave a little differently. And you're going to do the same thing if you're a juvenile judge, if you're a social worker, if you're admin, if you're a teacher, if you're a pediatrician, if you're a child psychologist. All of these things that are out there, and even in the prison, every single place where that's dealing with those things that are often the hard things to deal with in our society. Every one of them would do things a little differently and be more effective if they really understood this, what this does to people and how this all works. So the idea is that, in fact, that this is a film that in which a shift in mindset actually can deliver real results. Mm-hmm. Very often these days you're under pressure to deliver metrics of impact. Well, we passed 5 bills and we, bought a billboard on Broadway and we tested our audience and got an 80%. It's amazing the metrics that you have to come up with these days. But the truth is like nothing beats just sort of trying to get people to see things differently. Just simple.
Yeah, absolutely.
I'm going to open it up for questions in a couple of minutes here, but first I want to ask Syl, you're a playwright. You talk narrative medicine. Give a critique of this storytelling.
This is brilliant storytelling, and I understand that as a documentary, you have a lot of choices to make, and the way in which you construct the narrative line in this, I think was great. I noticed at the very beginning, it starts with an innocent picture of a kid going downhill on a scooter, and I caught that right away. It was important to me. I think it's beautifully told, and you have a lot of heroic people who are working without knowing each other, who then get brought together, and that's a nice feeling to know that there are people out there who are working on these things, and then they come together to solve these problems. And in Minneapolis, we need to do that more. I mean, sometimes we hear about these things that are going on in other places, and I often ask myself, why aren't we doing these things here when, in fact, for example, from an African-American perspective, the inequities in this town are really amazing. We have terrible inequities racially. And why aren't we have smart people too, so why aren't we really doing these interventions? We're always lagging behind in terms of doing them. So I'm just thrilled that you were able to capture this in a way that people will really want to see it, here and elsewhere, but particularly here because I live here, and I'm really concerned about this community. So thank you for that.
Well, thank you. I have a question for you. As someone who, somewhat aware of Minnesota, but not really, the first thing that comes to mind for health to me is the Mayo Clinic, right?
Mm-hmm. Yes.
And also I don't know why, but I have this thing in my head that says really good drug rehabs.
Yes, that's true. That's true. Yes, that's
fair?
true. Yes.
So,
yes.
So I think of it, and what I understand with Mayo is that one of the things they do that's unique is they sort of have a wraparound approach to care in a medical sense where,
right.
It's not just, there's like a group. So it seems like the state's uniquely well positioned to really hit it out of the park on this front. But
Well, there's two, you're hitting some, talk about trauma-informed care.
Right.
I think we are learning to give trauma-informed care. But we also know if we're going to prevent ACEs, we have to work on a lot of those social determinants of health that the Mayo Clinic or the University of Minnesota can't do. The social determinants are what we do collectively to change the policies. Increasing the minimum wage, having stable housing, have better transportation, having less pollution in certain neighborhoods, having paid sick leave, having childcare workers make it
reforming the police.
Yes. So I mean,
who have their own ACEs.
I think we are set. We have a great medical care system, and I know many of the people in this audience are working on ACEs and really working on the prevention of ACEs and trauma-informed care. And so now I want to go to some of them and see if you have some questions or some comments right here in the front.
So I would like
play Phil Donahue.
Oh.
I work at North Point Health and Wellness Center, which is in the heart of North Minneapolis, and I would like to bring this movie to our medical staff. How do we do that?
I think you're holding the microphone to the guy who can tell you the answer to that question.
So we're sorting that through right now, but it'll be tiered in the next until September 1st. We're having some sort of select screenings, and it's film festivals, and then sort of high stakeholder. We'll do a screening with the National Association of County Governments, and we have one at the California Endowment, Robert Wood Johnson. Some of the sort of trickle down, like get these guys excited, and they take it into their worlds. So that's the next 4 months. And then community screenings will roll out via this same online platform. We went with this online platform because we're finding there's some, who here has heard of or is a part of ACE's connection with Jane Stevens? Okay, so some, right? It's amazing. Jane Stevens is the godmother of this online universe around ACEs. And so the network there, and between Tug online platform where you can order the film and her network, we're finding that it's the easiest and best way to make sure that people can screen it when they want to. So September 1st, it will become community screening available, which is sort of one event. You know, you want to have an event and screen it for 10 or 100 or 1,000 people.
Right.
September 1st. And look online, tug.com. We're also at www.kpjrfilms.co, which is really annoying. And it turned out that we tried, this is getting off topic, we tried to buy kpgrfilms.com, and someone owned it, and we couldn't get it, and we couldn't figure out they had a firewall up, we could not figure out who owned it. And then we did our website and everything else, and then we found out, in fact, someone had bought it for us. And forgot to tell us. So, anyway.
So digital literacy is important in this endeavor.
And just to let you know, there's a lot of activity going on.
So
we have sent teams to Washington to learn about, Department of Human Services, Department of Health, a lot of community partners. So there's a lot of work going on with that, and we'll be doing more and more education about. This film will just be another piece to add to a lot of those conversations.
Yeah.
Another conversation. You're at the fourth row back there. You just holler out, and we'll repeat the question.
Okay, it's not a question, it's just a statement. My name is Andrew. I work at YouthLink. It's a nonprofit downtown Minneapolis. I work with homeless youth as a caseworker. I've been doing it for 2 years, and we utilize 9 principles, guiding principles, to help us with our work. One of the principles is trauma-informed, and our main focus is trying to re-engage what these people do with these young kids with young adults, because now they're 18 to 24, and all their trauma has built up to adulthood, and they don't understand how to take care of themselves anymore, or what it's like to be housed and understand their trauma and to stay housed or stay employed. And I don't know, I was bawling the whole time in this movie because it's a lot of our young workers who work with these youth. I'm 27, a lot of them go up to 24. The trauma that I've experienced too reflects with my clients, and to know that I'm probably scaled really high on the ACE is actually really emotional, because it makes me realize why I'm in the work that I do. But I just want to say thank you so much for bringing it out here. I try to get my coworkers to come, but we're all tired after work.
Thank you.
Oh, we don't want to. We just want us to go to a documentary.
First, I wanted to make a statement about the storytelling. I really liked how you presented all of the facts in the movie, but what I really enjoyed also is the breakout animations that sort of break down the topics so that it can be explained. It explains the full effect, from forward to, from the start to the end, and I thought that was a really powerful effect. And additionally, just sort of as a comment, one of the tricks with science is, the good and the bad of it is the discipline. So what we can see from ACEs is, people with this are correlated to these problems. What I thought was really interesting about one of the animations in particular is that it talked about the physical aspect. If somebody is stressed, they produce cortisol. Cortisol is a strainer on the body. It causes this effect. And thank you for drawing that line, because I'm not sure I would have gotten that otherwise. Secondly, have there been any studies, which is much harder to do, to draw a causal link as opposed to a correlative? And do you know of anybody attempting to tackle that?
Can I just say that I was really amazed to find out that my brain works differently because of the ACEs that I had dealt with. And so there's fMRI that actually can tell you and show you. But I also want to encourage you to not let the science intimidate you. What's really important is that now that we know about this, each of us can actually reach out to one other person. One of the things that can mitigate some of the issues around ACEs is if we actually have somebody that we can talk to, that we can trust. Remember the scene in the movie where the woman who I think she had a man in her life who was threatening her, but the worker came and was sweeping up with her, and she finally asked her, will you stay with me while I make this call? She had one person she could trust. Now let's see how many people we can reach out to with this new information that we have. And we can make the world better while science catches up to what we're doing.
Yeah, because I thought it was interesting. It said, toxic stress. If you have somebody you can talk to, you don't have toxic stress. Because really what is preventive is safe, stable, nurturing environments and relationships.
Yep.
That's what we really need, and we can all do that. That's not necessarily from the doctor or from the psychologist, it's from the community. So I think we're getting close to the end of the time that we have. So I'm just wondering, Sil, Jamie, any closing thoughts that you have for this wonderful audience that was here for this great, great film?
I just want to say thank you for coming, really. You know, we're all very busy these days and have a lot of commitments, and time is precious. And thank you for coming. And I can only imagine that a good many of you are working to help people out. And I think it's really important that as people become trauma informed, that there's a layer of support to those people as well, because I think you're asking something for people to take that extra step. Although some of the teachers from Washington State said, you know, it's actually easier to care than to be angry. And that was sort of an interesting moment. But still, it's harder, you know, it's harder. And if we don't provide the support and training, because, you know, this toxicity can be contagious. And if you're working in a hard environment where you're helping people all the time, it's very easy not to take care of yourself. And I've seen some really wonderful people just in the span of 4 years since I got involved burn out. And it concerns me. So take care of yourselves.
That's right.
Sil?
Yep, absolutely. Thank you for coming. We really appreciate having you all here. And thank you, Jamie, for doing this wonderful film. We appreciate it.
Thank you.
And you know, the definition of public health is what we as a society do collectively to assure the conditions in which people can be healthy. And in that definition, it doesn't talk about doctors or nurses or hospitals or clinics or even health departments. It says what we as a society do collectively. That means every one of you, to assure the conditions in which people can be healthy. And so if we can assure the conditions that everybody has a safe, stable, nurturing environment and relationships in their life, we will really create a healthy society. We will create a healthy Minnesota. The health of Minnesota depends on you helping us co-create that. So this is one effort in doing that, and you're all part of that public health team. So thanks for coming. Yep. Jamie, thanks again for this great film.
Thank you.
Good night, everyone.
Thank you. Really appreciate it.